It's 9 o'clock, Thursday, July 30th, 2020, and I call this meeting to order. Roll call, please.
Here.
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 Here. Here.
Okay, I want to welcome everyone to our special called meeting, those of you who are here and those of you joining us online. The purpose of today's meeting is to determine a plan for reopening our schools this fall. Ms. Perkins will lead us in the pledge and the moment of silence.
Please join me.
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Okay, we're going to begin with Dr. Thornton, who will share additional information for us to consider this morning.
Okay. Thank you, Madam Chair. I want to start with, again, what we are deciding today and focus everyone on the in-person continuum. All parents will have the choice, no matter what is decided today, to choose a 100% virtual learning option for the entire first semester. But what the board is deciding today is where we are in the in-person continuum, whether we will open fully, whether we will open with an A/B blended model, or whether we will be totally remote at all schools for a period of time. So first I want to go over the survey data that we received, and I want to thank everyone who responded. We had a lot of responses from the community. And the grand total you see, 3642, equals the number of children represented. So that is a very, very high number for a survey. And I do know we had some glitches if you had over 3 children, but statistically, that's not going to change much with any more responses. So if we look at that, in yellow is the in-person model, 5 days a week, and that's 36% of the population choosing that, and that's 1,311 students represented there. And the blue is the 100% virtual, and that was 1311, I'm sorry. The in-person yellow was 1329. So they're both 36%, and on the bottom in red was the blended learning model, coming in person 2 days a week, and that was 28%. So if you look at the survey data, the majority wanted some sort of in-person education. Well, there was 36% that wanted 100% virtual. We then broke it down by school, and the first one is Carrollton Elementary School, and the in-person, which is yellow, was 42%, the blended 20% on the bottom in red, and the virtual 100% is 38%. You go to Carsville, the in-person was 41%, and the 2 days a week blended model was 30% in red on the bottom, and the 100% virtual was 29%. If you look at Hardy Elementary School, you'll see the in-person 5 days a week in yellow was 34%. The blended 2 days a week was 23%, and the 100% virtual was 43% in Hardy. So you see Hardy was a little higher than the others with the 100% virtual. Westside Elementary, is 37% in yellow, 5 days a week, 25%, 2 days a week in the red on the bottom, and 38%, 100% virtual. Again, just a little higher at Westside. Windsor Elementary School, you'll see there 45% want 5 days a week. 23% in red want the 2 days a week, and 32% virtual. Georgie Tyler was 38%, 5 days a week. Blended 2 days a week in red was 27, and virtual in blue was 35. Smithfield Middle School, in person 5 days a week was 28%. The AB schedule in red was 31%, and the 100% virtual was 41%. So again, you see at the northern end at Smithfield Middle, you see a little trend towards more virtual and less in person. Smithfield High School, see a similar trend to the middle school, 30%, 5 days a week in yellow, 34% blended 2 days a week in red, and then 38% virtual. And then Windsor High School, 41% in-person 5 days a week in yellow, 30% blended in red, and 29% virtual. So you see Windsor High School leaning more towards some sort of in-person model. So I guess I'll stop there. Are there any questions on that data? Okay, I know you've had it for several days now. So next is the teacher data. So if you look at, this is the overall teacher data, and you see the 100% virtual option was 144 teachers, and the blended learning model was 130 teachers, or 36%, and the in-person 5 days a week was 85 teachers. So you see in this picture in yellow is the 5 days a week, which is only 24%, but there is 36% that would do a blended, and then 40% virtual. And then on your sheet, I know it's hard for anyone to see online, but there is a breakdown by school, and a lot of that data is helpful to us to determine once a vote is taken. Any questions from the board on that? Okay, so next I wanted to go over some key points that have been brought up. And first, the American Academy of Pediatrics. The AAP strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school. I know this one's pretty long, but it's the latest statement from CDC, so I thought I'd read it. As families and policymakers make decisions about their children returning to school, it is important to consider the full spectrum of benefits and risks of both in-person and virtual learning options. Parents are understandably concerned about the safety of their children at school in the wake of COVID-19. The best available evidence indicates if children become infected, they are far less likely to suffer severe symptoms. Death rates among school-age children are much lower than among adults. At the same time, the harms attributed to closed schools on social, emotional, and behavioral health, economic well-being, and academic achievement of children in both the short and long term are well known and significant. Further, the lack of in-person educational options disproportionately harms lower income and minority children and those living with disabilities. These students are far less likely to have access to private instruction and care and far more likely to rely on key school-supported resources like food programs, special education services, counseling, and after-school programs to meet their basic developmental needs. Also from the CDC, it says school officials should make decisions about school reopening based on available data, including levels of community transmission and their capacity to implement appropriate mitigation measures in schools. So that is the latest guidance from CDC. So I want to go to the next slide because this is a key consideration this morning as the board deliberates, is what are the determining factors for in-person instruction? So I'm just showing the continuum of in-person, again, which is what the board's voting on. Are we going to come back 5 days traditionally? Are we going to come back with some blended model? Or are we temporarily going to be online for all students? And what's the basis of that decision, whether the board votes to open up in some way in person or temporarily online? What's going to be the matrix that we either close our schools or open our schools, depending which way the vote goes? So one of the biggest determining factors, of course, is health and safety. And these are the latest rates, and you know, the governor came out with a message the other day and put some restrictions on the Hampton Roads area, although Isle of Wight was not included in those restrictions. And you'll see in some of the charts I show you, though, they group regions differently by different organizations, and a lot of times we are included in the Hampton Roads area. So that positivity was 9.9% to 18.6% when the statewide percent was only 7.3%. So you see why the governor made that decision, because the Hampton Roads area is much higher at this point in time. So the next slide comes from VDH, and you'll see the colors, and this is level of transmission by region. The red is substantial transmission, orange is moderate, yellow is low, and green is none. And you see there's no green anywhere on the map in the state of Virginia, because there's going to be a level of transmission when people get together anywhere. So I do want to point out, if you'll get up there, where Smithfield and Isle of Wight is, it's right in there. We are in the red area right now as a region. And you go to the next slide that was sent to us. We are considered in the eastern region, which is the second row down. And you'll see the burden on our region, which means healthcare facilities, items like that they consider, is a high burden. The trend is steady right now, and the level of transmission, like I showed on the last slide, is substantial community transmission. So the next slide I'm showing you is the percent of positivity by locality. And there it's easier to see Isle of Wight County. And you see in that metrics, we are yellow, which is low, but we are surrounded by red. So the decision really needs to be, as far as health as one of the matrix, is are we going to look at Isle of Wight by itself and its matrix, or are we going to look at the matrix in a regional approach? So that is what the board will have to consider. Is there any questions before you start? Okay. Thank you.
Thank you, Dr. Thornton. Each board member will have an opportunity to share their thoughts and possible recommendation for reopening schools this fall. And once each has had a chance to share, a motion may be entertained and seconded. There will be open discussion on the motion, and then a vote will take place. If the vote does not pass, we will have continued discussion and follow the same procedure until a decision is made. Okay, I'm going to be happy to get this ball rolling. Fear is real. The what-ifs invade our imaginations. And we have heard from many expressing fear for their personal safety and their loved ones' safety through public comments, through emails, and in the survey comments. We have parents and teachers who feel the time is not right to go back to school for in-person learning. And their feelings are real, and their feelings are to be respected. There are those who do not express fear, but acknowledge risks are always present and want to return to school for in-person learning, but within a safe and healthy learning environment, knowing things will not be as they were, things will not look the same, routines and procedures will be different. Their feelings are real and are to be respected. The reality in which we find ourselves in today presents challenges that go so deep. Challenges in which have no easy fix. Challenges that have emotions at an all-time high. Challenges with serious consequences, and unfortunately, the 5 sitting in these chairs will cast a vote that will directly affect the education of our precious children. A vote that will directly affect our dedicated and passionate professional educators. A vote that will directly affect the livelihood of our children's families. And there are such extreme opinions. And our responsibility as public elected officials is to serve those who put us here. And in order to fill this obligation, we had to listen with an open mind to our citizens, study the feedback from parent and teacher surveys. We had no questions today because we've had these surveys and we have been studying these results. Research, medical data, and professional opinions. We have to weigh the options by looking at the pros and the cons, and then we cast a vote. And while we differ on some issues, there is one thing every single one of us agree on. We want our children and we want our staff safe. And let me say, for those who may not know, I have 3 grandsons who attend Isle of Wight County Public Schools. 2 who will attend Windsor Elementary School, and 1 who will attend Georgia D. Tyler Middle School. So while I, as a school board member, care deeply for our children, our staff, and their families, and want to do what is best for all children, I am also speaking from the heart of a Grammy. As educators, we always study and use data to guide decisions and our planning. So let's take a moment to summarize the data. Again, that's what we do. The subject is health and safety, and it makes sense to review what the medical experts say. As Dr. Thornton has already said, but I'm going to say it again, because I spent a lot of time with these notes. The American Academy of Pediatrics strongly advocates having students physically present in school. The importance of, quote, the importance of in-person learning is well documented, and there is already evidence of the negative impacts on children because of school closures in the spring of 2020. CDC, the Center of Disease Control, had an article released July the 20th titled, CDC comes down hard on in favor of opening schools. CDC made the following statements, quote, "The harms attributed to closed schools on the social, emotional, and behavioral health, economic well-being, and academic achievement of children in both the short and long term are well known and significant. Further, the lack of in-person education options disproportionately harms low-income and minority children and those living with disabilities." And these are the top medical personnel in our country. Yesterday, I received a new report from NASA, National Academy, stating schools should prioritize reopening schools. Every medical professional who came to speak Tuesday evening recommends our children be in schools. Why are these medical experts saying this? Data for COVID-19 among children suggests that children are less likely to get COVID-19 than adults. And when they do get COVID-19, they generally have a less serious illness, and they also appear less likely to spread the virus. As of Saturday, 36 children under the age of 15 died from COVID, 0.03%. The flu, another contagious respiratory illness, killed an estimated 477 children under the age of 17 in the 2018-2019 season. I couldn't find more current data. If I remember correctly, it was reported Tuesday evening that the OPSI daycare centers never closed their doors since the pandemic began, yet have not experienced COVID-19 in their centers. I haven't heard of any such cases in surrounding daycare centers. Now let's look at the surveys. We are obligated to consider the results of these surveys. We should never ask for surveys to be completed and not use the data to help guide our decisions. So when we look at the teacher data that Dr. Thornton presented, it was well over 50% teachers saying they want some kind of in-person instruction. The parents, well over the 50%. I don't have the exact percent, but if you could get that for me, I would like that. The best decision may be giving choice, allowing parents to make the best choice for their children and their family. Mr. Wilson has said, every child, every situation is different, and we don't want a one-size-fits-all decision. We've already said one choice for every family would be virtual learning for children whose parents who are not ready to send their children to school and feel it is best for their children and their family. The decision is to be honored, respected, and we as a school division should have staff who are dedicated in making this a successful and productive semester for those children. Virtual teachers will have their class roster, their curriculum, and a schedule, and come to school daily to instruct, plan, and communicate to children and families, not in person, but in a virtual format. For this to happen, parents will need detailed information and training to know what to expect and to fully understand their responsibilities. Along with that option, I am recommending another option for families, parent choice. We will provide in-person learning for children whose parents feel this is best for their children and their family. They're ready to send their children to school with the expectation for their child to enter a safe clean learning environment with all safety measures in place and knowing school will be different and support the changes. In-person teachers will have their class roster, they'll have their curriculum, they'll have their schedule, and they'll come to school daily to embrace the necessary changes and ready to teach new procedures and routines and ready to provide daily instruction to their students. Now, this is where my recommendation gets tricky. I support 5 days a week for our elementary children. They need it. And I speak from experience here. I have taught preschool, kindergarten, first grade, second grade, third grade, fourth grade. I have been an elementary principal. I have been an elementary assistant principal. I have been an elementary director of elementary education. Early childhood is my heart, and it has been my profession for 33 years. And I know the dangers of these young children getting behind in a foundation that is being built. And we know that data says that if they don't know how to read by the end of third grade, the detrimental journey that they have ahead. Their learning foundation is being built. As I said, it's such an incredible, important time in their educational journey. I'm not confident that we can begin school with a 5-day-a-week plan. Looking at our numbers, we may have too many to implement the needed social distancing. And we won't know that until we have the sign-ups. But if our sign-up numbers say we do have enough space for social distancing for a 5-day school week, there still is an advantage to beginning the year with the hybrid model. The hybrid model, some children go to school Monday and Wednesday, and some children will go to school Tuesday and Thursday. That will certainly accommodate social distancing and support bus transportation. Beginning with this model will allow the drop-off and the pickup challenges to be worked out. Teaching the new procedures and routines will be taught with fewer students and help everyone adapt to the changes in smaller group settings. If things work well, and it is determined that social distancing can work, at a designated date, we could transition to the 5 days of instruction. We could do the same for the middle school. Begin with the hybrid model, giving parents a choice, and at a designated time, determine what the next step is. Stay the same or move to a 5-day-a-week program. That should be our ultimate goal. But we have to be flexible. We don't know what may happen. There is a possibility we could shut down as we did last spring. But we will be prepared this year if that were to happen. I'm for taking 1 foot forward for those who choose to return to school, but to do it slowly, safely, see how it goes, and then plan accordingly. This model will have us implement new safety procedures with fewer students, with the goal, should be all of our goal, to move to 5 days a week. We won't know what the next step is until we see the success of the hybrid model. Then high school. My recommendation is to open the high school year total virtually for the first 9 weeks. We will learn from elementary and middle school experiences to determine what may be the next step for this group of students. Remember, our high school students are more likely to have a positive virtual learning experience than our younger children. Will they remain virtual for the first semester? Will they move to the hybrid the second 9 weeks? Or will they move to 5 days a week at school? That is yet to be determined, but our goal should be to get our students back in school safely. So my recommendation is to open with parent choice for elementary and middle school and have 100% virtual for high schoolers the beginning of the 2020-2021 school year. Again, the goal is to get our children, including high school, who want to have in-person learning to be in school while giving everyone the choice to experience total virtual learning as well. And then I think about the high school CTE. That's a separate subject in which we can discuss and maybe have a totally different plan. But with this plan, we will need in-person and virtual teachers. Thus, those teachers who choose virtual because of health risk will have the opportunity to apply for virtual teaching, and the higher at risk will be considered first to fill all the needed positions. At this time, we can have some discussion on these ideas that I've presented, or we can move on to another board member's thoughts and recommendations.
Madam Chair, I think you've pretty well expressed the options that we have before us and done a magnificent job of it. And so my recommendation, if there are no additional questions if there are no questions or comments from the audience, to go forward.
I don't want to entertain the questions from the audience.
That's what
We
I'm
want to
saying.
keep the board meeting today.
Right.
Did any more from,
I mean, I have comments, but not questions in regard to.
okay, that's what we want, yeah.
Okay. Yeah, I don't type out speeches. That does not work for me. But, so, like, okay, just, it's a lot, and we all know it's a lot. I do have 3 kids in our school system, 2 at Carrollton Elementary, 1 at Westside, in the 6th grade, so I guess in the southern end, she would have been at the middle school. I'm not a fan of the 5 days in person. I don't feel like we can socially distance at this point enough without having the information to socially distance, to know exactly how many kids are in or out. Even if we cut our classes in half in Carrollton or Westside, my child has never been in a class less than 24 to 26 kids. So that's socially distanced. I don't see how we could do 5 days a week to start. I do agree that the goal, as always, is to get all those kids back in the classroom ultimately. At this time, I do feel that virtually for the first 9 weeks is the most prudent. If we're saying we don't want our high schoolers to go back because we're concerned, why are the elementary school students? If we have concerns for our high school students going back and being virtual, why are our elementary students okay to go back for that 9 weeks? So I have concerns in that regard. I've seen, my kids are good about wearing their masks. We wear them in public all the time. I have not taken my kid inside a grocery store, any of them, since, I guess, March. I don't take them into public places they don't need to be in. I have pretty much isolated my kids, excluding a few friends that I know we've been isolating together, and I'm sure other families have been doing similar things. But my kids haven't been exposed to anything. And a lot of people have been doing the same thing. Their kids are home. They're worried about the safety of their children. So to be fair, we don't really know the effects of coronavirus on children because all the children have been inside our homes locked up. Not like in a locked up way, but they can go outside and play. Please. I'm home with my kids. I love my kids, but God only knows I want them to go back to school so badly. But I want them to go back when it's safe. The rates in Isle of Wight have gone up. They have not gone down. The trending statistics are still moving up. I'm more comfortable, if they were moving down, I would be more comfortable with sending them back to school. But we're not seeing that. When I live in the Carrollton area, the Smithfield Carrollton area, when anyone goes anywhere, they need to go to Walmart, if they need to go to pretty much any store outside of Kroger or Food Lion, they need to leave Isle of Wight and go into these red zones, which exposes more people. My husband works in Norfolk. Most of the people in my neighborhood work at the shipyard. They're all going into these hot zones and coming back. And I'm not just concerned for our students, I'm concerned for our teachers. I've read multiple studies recently that anyone 10 and up can transmit the virus like an adult. So our teachers are, if we get a virus that spreads, and let's say the kids are asymptomatic, and we don't know the long-term effects, because I've read articles that talk about engorged hearts, lung issues long-term, but we don't know the effects of these things because, again, I don't know, my kids have been pretty much confined. They haven't been at church, they haven't been activities, they've been home. We don't know, and I'm skeptical to roll the dice because one death is too many. One child's death is too many. Their health is way more important. I would rather have my child alive and healthy, and I have a struggling reader, and I have kids, I have a child who needs help and needs to be with someone to learn, needs to be, and I understand that, and I want them back in school, I truly do, but I want them back when it's safe. And I personally am not willing to put my kids' health at risk so they can sit in a classroom, and they're not gonna be it's not gonna be the same, they're gonna be 6 feet apart all the time. They're not gonna be able to sit and eat lunch with their friends like they were before. They're not gonna be able to have one-on-one, they're not gonna work in groups. They're not gonna, why can't we do that virtually for the 9 weeks? See what the virus does, because we know it's gonna get worse in the fall. I haven't seen anything that says it's gonna get better when we get to the fall. So I do have concerns in that regard. When the doctor, we talked about the doctors last time, and I do respect both of the popes. I actually attend their practice. He said, I don't remember if it was 178,000 or 78,000 kids are gonna die for herd immunity. To me, that's statistically, yeah, that's not a bad number, but what if one of those 78,000 is your kid? That's not okay. The teachers are our brothers, our sisters, our moms, our dads, our friends. I'm not comfortable putting them at risk. I'm not comfortable putting our kids at risk. And the more I think about it, and the more I pray on it, I can't have that. I can't have that responsibility and weight on me when we had an option that keeps more people safe. I feel the teachers are essential workers, just like the doctors and nurses, but they can do that essential work from home. They don't have to be exposed the way a doctor or a nurse needs to be exposed. They can do the work from home, and they can do it well. And we're only going to get better with time. I voiced my concerns about issues with the spring and my frustrations, but ultimately, I do think that virtual is the best option, at least for the first 9 weeks. We can reevaluate, we can come back to the table, and if things are looking better, we can go to the AD option. And then hopefully by the end of the semester, we can go to full 5 days. Look, I would love to have my days back and my kids be in school with their teacher who knows how to teach them better than I do. And I'm a certified teacher in the state of Virginia as well. I know educational best practices. I have a master's degree with a focus on literacy. I'm not, but not everyone has that training, and I understand parents' frustration. But that's why our new virtual model is much more in-depth, much more helpful for these kids. We have 44% of our teachers that were worried about going back. We have the teacher organizations telling us that they want to go virtual. The emails I got last night, I got 48 emails last night alone, and I responded to all of them. I was up till 1:30 a.m. responding, and the majority of the emails I received last night were, please don't send the kids back. Please let us teach virtually. The only kids I am concerned about with the virtual learning are the CTE students. And I don't know how to safely do our CTE programs for the first 9 weeks virtually. And that to me would be the real challenge here, to see how we can do that. But if we're talking virtual for high school, because it's not safe for them to come into school, it's not safe for the staff, then I have an issue. Then how is it not safe for a high schooler, but yet safe for my first grader to go into the school? I don't want to knock the cleaning company or anything, but I've been in the bathrooms and stuff in our schools regularly. We've had issues with cleaning in our schools in the past, and I have concerns there as well. In the military, they're wiping down well-used surface every 2 hours. They have someone come through and wipe down high-used surfaces. And so there's no way we're going to be able to do that. I mean, kids touch everything and everyone, and I don't know how to keep my kids 6 feet apart when they start fighting, and I have 3. And so I don't know how we can keep a class of 6 or 10 or 15 or whatever because we don't know what the amounts are until we get the numbers back. But I do have the more I think about it, the more I feel comfortable moving to a virtual option for the first 9 weeks and then reevaluate it. Because I do want them in school. I do, and I know most parents do, and I know working is an issue, and I know there's a lot of issues that we have, but there's a lot of issues no matter what situation we pick. But I feel the safest option is, virtual for the first 9 weeks, and because just one death of a teacher, one death of a student, that's one too many. And so that's where I'm at with it.
Okay, I want to address what you said because it piggybacks on what I said. The recommendation of high schoolers going virtual has absolutely nothing to do with the safety. We are wanting to take one step at the time. I would never make a recommendation to put my grandchildren in a situation that wasn't safe. With the mitigations that we have set up, we could take that first step. But always, if things start going downhill, the option of we got to close, we can't do this, it could happen as quickly as it did last fall when schools closed. So the idea is to take one step at the time, and where our little ones, we know, are not as good at the virtual piece as our high schoolers are. That's the reasoning behind that.
But the whole thing is about safety.
As far as, absolutely, it's all about safety. And then the daycares, they have been out there. We've got to look at the data, and we can't let fear drive us. When we sit here in 9 weeks, what possibly may change? We might be right where we are right now and be at the same place, but our children are a little bit further behind because we know that in person is not as effective as those who are not with their teachers. And I want to say that these surveys, why in the world are we asking our teachers and our parents what they want when we have got way over the amount that we could have successful in-person safe learning with parents wanting to send their children to school and teachers wanting to teach their children in school? Why are we going to ask them their opinion and then we say, thank you for your opinion, but we're going to do what we think is best? We have to consider their options, their opinions.
If you think I'm not considering the data on this, this is a peace symbol.
We are looking at, when you look at the in-person teaching, take the yellow and the red and put it together.
Well, then you could
That's
say
the
the same thing
in-person.
for the virtual, because the in-person 2 days, they're virtual 2 days.
Madam Chair,
Yes, ma'am.
I wish that we could refrain from bickering back and forth with one another.
I'm just trying to respond.
I agree with you, Mrs. Perkins. I haven't said anything this morning because I was just listening to my colleagues, but I understand exactly where you were going with this, Mrs. Hewlett, because we are responsible for every child in Isle of Wight County, and not just those in K. Well, we have preschool to 12th grade. It's not just those. we also are responsible for adult education programs as well. So when we consider this, we're considering all programs under Isle of Wight County Public Schools. And if I'm going to make a decision today, whatever decision I decide, I'm not going to put half of the children in harm's way and put the other half and say, you can stay home. I mean, you know, something's wrong with that picture. We have experts out there in the world, we have experts in the United States, in the nation, that is actually, they don't know. They tell us daily, we don't know. This virus has a mind of its own, and it takes its course on its own. We don't know what's going on. Just like Mrs. Hewlett said, majority of our workforce in Isle of Wight County leave the county and go into those hot areas to work. Majority of our students have been home on a shutdown. Most parents had them on a shutdown basis since March. We don't know what's going to happen if we send them back in person, whether it's 5 days a week, whether it's a hybrid or whatever. I would hate to send anyone's child back into a situation where I know personally, if I had a child and I had an option, whether to send them back to school or leave them home in a virtual program, and I know the school system has a wonderful program, more so than what they had in March, because none of us had anything planned for this in March. Well, as a parent, if I were in that situation, I would choose probably to go virtual until our scientists, our medical field could get a better hand on this virus. We do not have a better hand on this virus in this county as of yet. There are families in Isle of Wight County that are positive. We don't know that. You don't know that. I know some personally. And yes, they have young children in their home. And yes, these families, if they had not known that one in the family had tested positive and the others has to be tested, they would have been sending those young children back to school with those that we say need to come back to school. Now, that's what we need to think about, those things. There are a lot of people in Isle of Wight County that have never been tested. If this was something where everyone had to go to a center and say, we're going to test everybody, either you're negative or you're positive, majority of the citizens have not been tested. So we don't know. And they are living in, these young children could be living in the household with someone right now that could be positive. And we send them to school in September. Personally, I don't want to be a board member to have to send condolences out to anyone. I don't want Dr. Thornton or his staff have to send condolences to any family, whether it's a student or a staff member. I don't want that to happen because some parents need, and this is pretty much, I'm going to say it, some parents need us to be their babysitting services. We are not a babysitting service. We are our institution of learning. Just as you have the higher ones, the colleges, we're just on a lower level. And that's where I stand. If you fail to get babysitting services for your children, Isle of Wight County Schools will not be it, okay? I'm sorry. Now, if you need some assistance, come to us. We will see what we can do in the community. You have your Y program, you have your social services. There are a lot of programs that we can refer you to help you with that service. But we are not your babysitting services. We are your institution of learning on a lower level. Thank you.
Madam Chair, if I may, I think we have two things to look at, both of which have significant positive things about them. The all virtual has positive aspects. It protects every child from every other child who might be infected. But it also creates some issues in terms of being with other children, being with other people, learning from other children. The problems with students being back in school, there are potential problems. When children are together, when adults are together, diseases get passed. However, with this particular virus, I believe we have learned that there are things that we can do to help mitigate and help prevent contracting the virus with face masks, with social distancing. And I believe it's important for our children to have the ability to interact with their peers, particularly our young children. Because it appears to me that our babies, our elementary students, are actually not progressing at anywhere near the rate that they were progressing before the virus affected us and caused us to shut down schools. I think if you ask any elementary teacher in this room if students now in first, second, third, fourth grade were as academically developed as they were 3 or 4 years ago, they would say, no, they're not. They're behind. I think there's a great deal of importance for our young children to be able to associate with one another and to be in the school setting, whether it's an alternate day setting or whatever. And I think this could be a possibility. And that the numbers would be small enough if we went alternate day so that we could do the social distancing in class. We could utilize buses, have enough buses to transport if we did alternate day. And it might also give us the opportunity to help our special needs students on Friday, which is another group that is suffering sorely as a result of being out of school. Our special needs students need a great deal more attention than they are getting with what we're doing now. And I think that there are ways to mitigate that, and I think the best way to mitigate that is an alternate day A-B schedule, with Fridays being left open to bring in our special ed students when they need assistance. Thank you, Madam Chair.
Madam Chair, Madam Chair, before Mr. Wilson says something, I did want to add that I will be willing to, if we go virtual 100%, to have staff to open up some help centers for those parents, and well, especially for the students and for the parents that feel that their child will need it. And those help centers will be at different locations within the county or wherever the staff feel they need to have them, and they will be in-person help centers.
Madam Chair, before Mr. Wilson goes, could I clarify where we are in the phases and why you could open at an elementary level and not a middle and high? And this is not mine. This is from the governor's plan. So we are currently in phase 3, but in the governor's plan, in phase 2, if you socially distance, which could mean A/B, they are recommending pre-K through 3 and special education students attend in a socially distanced environment because it's basically been proven that they're the most difficult to educate virtually. So that is a governor's plan, if he moved us to phase 2, that we could do. but we are in phase 3. So I just wanted to clarify for those who wondered why you would recommend elementary and not middle and high. And also, at middle and high school, those students are not in a cohort. They do have to switch classes, and putting that many students in the hallway, even if you do AB, at Smithfield High School, would be 600 students in the hallway, and we don't know how they're going to act or if they're going to keep their masks on. So I believe that's why the governor has made that recommendation for phase 2. Thank you.
Thank you.
Thank you. Thank you, Madam Chair. The only child or children that I'm really concerned about, get this good now, is every child. Every child. I don't believe no one is here to play Russian roulette with a child. And we all have some tough decisions to make. But when you think of the interests of every child, then it's not quite as bad as we might sort of think it might develop it into. You don't know what's going to happen. None of us know what's going to happen. The only thing we can do is try to have something in place that improves what we have now until we decide that we're going to try to make something else. Once I was told that a man starved to death in the presence of a whole platter of delicious food. He couldn't decide what to eat first. He wore himself down. If any parents are in the audience, sometimes I know I do, I had to stop and take a look at these percentages. Even though I worked on every educational level that you have, from the superintendent to a classroom teacher to a bus driver, right on down the line, every one of them. I have certification, every one of them. But it's not about me. It's about the children that we are trying to plan for. We've been dealt a rough hand as we are trying to play out. Your children, I'm sure, are in a position that we are almost in that position where we are preaching to the choir. But the parents are working. They voted us to take the best care of their children whenever they send, or every day they send them to school. Making a decision is hard because one size don't fit all. We have to try to meet the needs of every one of our children to the best that we possibly can. Today, you cannot tell me what's going to happen tomorrow, but we can say we can try. And we do the same thing we do when we're traveling. If we find out after we travel a while, we missed the exit, you don't keep on driving. You try very, very hard to get back on the right road, get back in the rhythm, and also go ahead with our journey. The rubber will meet the road when these children come back through these doors. Are we ready for them? How are we going to get ready for them? I don't know. The only thing I can say is to do the very best that we can for all of the children. As I said initially, the only child I'm concerned with is every child. Thank you.
Okay. Well, we've heard from every board member, and we're all passionate about this. We all want to do what's best for our kids. And so I'm ready to make a motion, and then we'll see what happens. I make a motion that we open elementary and middle school with parent choice with the hybrid at the beginning of the school year, and that high school will open total virtual and reevaluate at least by the end of the first 9 weeks. Let me say that again. Motion that we open elementary and middle school with parent choice being 100% virtual or hybrid. And then high school will open total virtual and reevaluate at least at the end of the first 9 weeks.
Second.
The motion has been seconded. Is there any discussion before we take our vote?
Madam Chair, will you repeat your motion, please?
Okay. So my motion is that we open elementary and middle school with the parent choice of I choose to keep my child at home, 100% virtual, where I will have a teacher assigned to my child and get virtual learning. The other parent choice would be in school, which would be the hybrid, which means there would be one group going Monday, Wednesday, one group going Tuesday, Thursday. Teacher planning for Friday, or I guess in the planning, it may be some additional special needs children coming in with their needs being met. That was middle and high, no, elementary and middle, and then high school would open with total virtual, and we would reevaluate that at least by the end of the first 9 weeks. So everyone in elementary and middle with parents and a lot of our teachers would have a choice, because looking at the surveys, we've got a lot of teachers who want to do in person, but we have a lot of teachers who choose virtual, so they would apply for virtual, and we would take those with high risks to be those who would do that teaching first.
But there would be teachers who didn't want to go back. Maybe they don't have a medical, maybe they have a grandparent they're taking care of. And
Possibly.
We would be forcing them to come back to the classroom, even though they specifically in the survey said they did not.
That could be a possibility, correct, Dr. Thornton?
That's correct.
So, again, in a nutshell, I motion that we open elementary and middle school with parent choice being 100% virtual or hybrid, or the hybrid, with the goal of moving to 5 days a week, but that would certainly not be done until, like Mr. Wilson said, we got to take one step at a time, and we've got to see how things are going here before we take the next step. And then high school would open with total virtual and reevaluate at least by the end of the first 9 weeks. So I made the motion. Ms. Perkins seconded. Are we ready to take a vote?
Okay, this will be a verbal vote, and we'll do one at a time. Ms. Ulick?
No.
Mr. Wilson?
I'm not ready yet.
Yes.
Yes.
No.
Do you need me to repeat the motion? Yes. You need me to repeat the motion, Mr. Wilson?
She can.
Okay. So the motion is we would open elementary and middle school with parents having a choice. Their choice would be, I choose to keep my child at home. I don't feel safe sending my child to school. So that could be their choice, to keep their child at home and have a teacher assigned to them to teach them at home where their parents have chosen. But the other choice for parents in elementary and middle is, I want to send my child to school. So they would go 2 days a week. One group would go Monday and Wednesday, and the other group would go Tuesday and Thursday. That allows for social distancing. That allows for bus transportation to take these children to school and home with half the children. I mean, you won't have those on the bus.
Madam
that-
Chair, can you just read the motion, not explain the motion, and Mr. Wilson?
Do you need me to explain it, or am I going too much?
No, I'm with you. We're on the same page.
Do you want me to continue explaining it, or do you want me to just read it?
Oh, you can read it.
Okay, so the choice, the parent choice, going virtual or parent choice, where they go 2 days a week. And then the high schools, they would open total virtual. They wouldn't have the choice to go to school for the first 9 weeks, but after the 9 weeks, they would have the choice to go to, we would come back and reevaluate.
Okay.
Okay, so your vote, yes or no?
Yes.
So the yes, we have 3 yes and 2 no. So we will have parent choice for elementary and middle and total virtual for the high school. Mr. Thornton, Dr. Thornton, do you have anything you want to add to that? Like now, what's
Yeah.
next?
Yes, so next week on Wednesday at Georgie Tyler Middle School, we will have a parent information meeting about the choices, and that will be in the morning at 10 a.m. at Georgie D. Tyler Middle School, and at 6 p.m. on Wednesday at Georgie D. Tyler Middle School. So we'll have a morning and an evening session at Georgie D. Tyler on Wednesday, and those will be live streamed as well for those who could not attend. And we will try to inform you with as much information so that parents can make a good choice. On Thursday of next week, right here at Westside Elementary School, we will hold the same type of meeting for the choices in the morning at 10 a.m. and in the evening at 6 p.m., with both being live streamed. And parents will need to make a decision by Monday, August 10th, and principals will be working with their individual parents to get this information. And as far as teachers, we do have an online instrument of how to apply, and if you want us to share any of that at this point, Mr. Lombardo could do that.
Madam Chair, may I say something to Dr. Thornton? Dr. Thornton, is it possible you could send us that schedule that you just read off?
Sure,
To the
you can
board.
discuss it.
Could you email it to us?
It's not a
like-
board, it's not a board meeting.
Right, it's for
right,
parents, right.
Right.
So that will be communicated by email, social
Yes,
media?
we will blast that out, and, yes,
And both meetings will cover the same information?
yes. We're just trying to provide options for parents who may be available in the morning and want to come in person to see.
And then you said that August the 10th is when the parents have to have made their decision?
Yes. And that's in order for us to, we will have to take all the students at each school that choose totally virtual, 100% for the first semester, and those who choose the in-person model, and separate those numbers, separate the teachers. So we have a lot of work to do from basically August 10th to open September 8th.
I have a quick question.
Sure.
When it comes, since the high school is virtual, is there any room for the CTE students to come back with the high school being virtual, since we do have other students coming back? Because they cannot do CTE courses at home, since we're all going back in anyway.
Why can't the high school be blended? You're out of order. We have a meeting going on right here.
So we have, in all of the meetings and discussions that we've had with staff, I know Mr. Mordecai has talked individually to the CT teachers who are very hands-on, such as welding, food service, building trades, and those fields. And I believe the feedback was that they would be willing to come in 1 or 2 days a week and work with small groups of students who are able to come and do those things. So,
Can we look more into that? Because I agree that they really cannot get their CTE certification without in-person.
right. So, I guess because of the vote, you could do an additional vote and give me the permission to bring in CTE.
Madam Chair, I'd like to add like an amendment to the vote, as in to add CTE students to the group that can come back to the school system.
Second.
And is that in a blended model?
Yes.
Yes, okay.
Okay, so we have a motion to amend the amendment to include CTE students to come in the hybrid model. Is that,
Yes.
Yes.
okay? And Ms. Tynes seconded the motion?
Yes. Yes.
Yes.
Yes, yes.
Yes.
Madam Chair,
Yes, ma'am.
I have one other suggestion. With the virtual instruction, I feel like it is very important that the teachers be in their classrooms when they are doing their instruction to their students. Is this a possibility, Dr. Thornton?
Yes, that's more of an organizational question that my staff will handle, but we are looking at requiring all teachers, whether they're virtual, not to be in school. The reason for that, their resources are in their classroom, and also we'll be developing curriculum together to make sure curriculum is aligned, and for them to work with their principals, instructional coaches as well, because we have to ensure that we have an aligned curriculum, whether they're in person or whether they're virtual. So yeah, we plan on that.
And the only reason I bring this up is this was a suggestion made to me by numbers of folks who responded to the
And we've had a number of teachers contact me or my staff and ask if they could be in their classroom because of their resources. So, yeah, so we will have our teachers in.
Thank you.
Okay. Is there anything else we need?
I think one thing, Brian, if you could pull up the first slide with the continuum and the virtual, because there probably will be some confusion with high school being all virtual, and I do want to clarify that. No, this one right there, yes. So, and we'll go over this with parents next week, but I just want to be clear. So, what the board voted was that in-person continuum, and at the elementary and middle, they voted for the blended model. But for high school, what they voted was temporarily remote. So as you make your decision for your child, what you're deciding at the high school level is, do I want to be temporarily remote for 9 weeks at the high school, knowing that if the board after 9 weeks opens the school, then I will be in either a blended model or back 5 days. Or a parent can choose, no, I don't want to be on that continuum, and I want to be totally virtual for the first semester. Those are two different choices, and I just want to make that clear. So what the board did is say for in-person right now at the high school, we are temporary remote. but a parent can still choose 100% virtual for the whole semester. And we'll go over that in detail next week, and we'll have some written documents, and we will try to be as detailed as we can so parents can make a really informed decision, and we'll do that with their principals and their staff at their schools.
And if there are parents who do not respond by August the 10th, how will we handle that?
That's a good question. If they don't respond,
I mean, we've got to educate them, so are we
Right.
going to reach out and say, we haven't gotten a response?
right, we're gonna reach out, but ultimately, if we don't get a response and you're still enrolled, we're gonna enroll you in in-person continuum. So, but we'll do a good job reaching out and contact people.
Okay, thank you. The meeting is adjourned.